Welcome back. As much as 80% of a child's learning is visual, with kids spending most of the school day reading, looking at a board, and using laptops or tablets. But 1 in 4 school-age children struggles with reading and learning because of undiagnosed vision problems. While many K-12 schools offer vision screenings for students, those screenings often are not good enough. VSP Network optometrist Dr. Jennifer Wademan joins us live today to talk about the importance of comprehensive eye exams. Good morning.
Good morning.
Yes, thanks for your time and thanks for joining us. Why is it important for kids to get their eye exams before school starts?
Yeah, great question. So, how our child processes, how their brain processes information really is quite complicated. And so if a child's not seeing clearly or their eyes are not working, equally together well, we could potentially see some issues in the classroom with their academic performance, overall confidence, and well-being.
Well, with that said, maybe some kids have some reservations or are a little nervous about an eye exam. Kind of talk about what happens during an eye exam itself.
Yeah, so an eye exam for a child's a little bit different than an adult. We make it pretty fun. For the young kids, real little kids, oftentimes I don't ever need a response from them. And so, we use a variety of different things from cartoons. If a child can't read letters or numbers, we have pictures. And so essentially I'm looking at, a variety of different things with their eyes, how their eyes are teaming and working together, how well they're seeing, far away up close, if they have prescription needs, if they have astigmatism, nearsightedness, or farsightedness. Another area I check is overall eye health. So I'm looking in and around the eyes to kind of get a better understanding, if there's any issues or, essentially just to make sure everything looks good and healthy.
Yes, you make it a breeze. And then, for parents or
Yes.
caregivers watching, what are some of those warning signs, though, that a child might be in need of glasses?
Yeah, and often kids don't realize that they're not seeing how they should be seeing. So, some signs to look for as, a parent or a caregiver would be if your child's squinting, if you notice from, they're watching TV and they're squinting. Or, as we approach the school year, if they're avoiding certain activities like reading, sometimes that can indicate a vision issue. Other things to watch out for would be, a child that's rubbing their eyes a lot, a child that's, gets overly fatigued with, certain activities. One thing I tell parents in the exam room is if your child is tilting their head or turning their head in a certain manner, there might be an underlying vision issue.
Interesting to keep in mind. And then, finally here, so many kids are on tablets and screens. What's your take on that? How can that affect their vision?
Yeah, definitely tablets, more frequent in the classroom, but I can attest to this at home as well as a parent. We do see some, symptoms with prolonged device use, and that would be dry eyes, even in our young kiddos. And so, if we're staring at a screen, and we tend not to blink as much. Headaches, fatigue, similar symptoms like that can arise as well. One thing overall that we're concerned about is just an increase in nearsightedness, because we're seeing kids develop myopia or nearsightedness at younger ages. And, all this near work and screens are a huge culprit. So we really want to take the time to unplug from those activities.
Yes, great insight, and you can consult your optometrist too for the best frames for your children. Our thanks again to optometrist and mom, Dr. Jennifer Wademan, for her expertise. Thanks for your time.
Thank you.